She used the word murder, coming from a nurse who went to New York City expecting to help. Patients are left to rot and die.
Hey guys, so you've probably seen this video going around the media, and it is of this nurse practitioner who is recounting her friend's story that alleges that New York City hospitals are actually hurting their patients. How someone could post something so abjectly wrong is beyond me, but I was hoping to clarify some of her facts with actual facts. And I'm not a secondary source like her friend in New York. I'm a primary source because I'm an ICU doctor working in Queens, New York currently.
In New York City right now, in some of the hospitals, this is what is going on. People are sick, but they don't have to stay sick. They are killing them. They are not helping them. She used the word murder. Patients are left to rot and die. Her words. She has never seen so much neglect. No one cares.
Pretty sure we care. Pretty sure Jerry, Felix, Christine, all of us, when we got sick and we came back to the hospital to care for people, pretty sure we care.
Now, a couple of weeks ago, I was on with some nurse friends of mine, and we were discussing different medications that could be used to potentially help people. Doctors who were reporting around the country that they were using a combination of medications that were helping people. People were not dying when they were on these medications. They were getting better. Those medications are not being used in hospitals in New York City.
If she could tell me what these medications were, that would be great. And I would actually really like to know what these medications are.
Is that they're putting people on nasal cannula. If they require more than 6 liters of nasal cannula, they get intubated, they go on the vent, or they get trached if there's not enough vents. They don't get high flow, no non-rebreather, no non-invasive ventilation, no CPAP, no BiPAP. They're on a closed system, the ventilator.
Exactly.
Versus a CPAP or a BiPAP for fear that it will spread the virus.
So she explains why hospitals were initially hesitant to start high flow or BiPAP in these patients because according to the Society of Critical Care Medicine, there are only about 100,000 respiratory therapists, 500,000 critical care nurses, and 30,000 full-time intensive care doctors in the United States right now. So each one of those healthcare practitioners has the potential to care for hundreds of patients. So when one of them stays home sick, it puts strain on the entire system and can adversely affect the outcomes of other patients that are sick.
Patients don't know any better. They don't have family with them. There is no one there with them to advocate for them. So they are scared and they give consent.
I'm not sure if you've ever actually worked in a hospital, but we don't typically ask for consent when somebody is obtunded from hypoxemia and needs to have a breathing tube in. They're usually in extremis.
The ventilators have high PEEP, high pressure, which then causes barotrauma. It causes trauma to the lungs.
Sort of true, but there's also decades of research that show that high PEEP improves mortality.
The protocol is propofol or some kind of sedation because they're
and
on a
you'd
ventilator.
like to be comfortable on a ventilator.
And IV antibiotics. There's no hydroxychloroquine. They're not using that combination with Zithromax. They're not using zinc, vitamin C, high doses of vitamins A and D.
I'm not going to comment on that.
It's a horror movie, she says. Not because of the disease, but because of the way it's being handled.
Pretty sure it's because of the disease. Having seen hundreds of people, young and old, with medical problems and no medical problems, it's definitely the disease. That's why it's a horror movie.
So nurses are being celebrated as heroes, right? We see how like the fire trucks and the police are like lining up and practically having these parades and celebrating them as heroes.
That's because they are heroes. They're literally risking their lives and their families' lives to help take care of you and your family.
You're not even going into patient rooms. You're a coward. You're hurting people. You're killing them. You're contributing to the problem.
I don't think your rant is contributing to the solution.
I'm really fortunate. I don't have any family in New York City that I personally have to worry about. If there's a medication that you want your loved one to be given, report it as an at-home medication and demand that it be continued. That's just a tip from inside the system. If you want a medication to be given,
has this lady ever actually worked in a hospital?
You've got to report that it's an at-home medication
it
and that you demand that it be continued.
Yes, ma'am. I'm going to be your doctor today. Could you please just let me know what medications you take at home?
Yes, dear. I take ritonavir, and I take remdesivir and tocilizumab at home.
Do not give consent for intubation if you don't want to be intubated.
And that's about the only thing I actually do agree with her on. It's very important that you and your family, you talk about these sort of things. And if aggressive care and being on a mechanical ventilator are not the sort of thing that you would want, you should definitely make it known to us. I've never seen someone so disconnected with actual clinical care, but the truth is that we're all working very, very hard to care for everyone, and we're truly doing our best. And what this lady is saying is absolutely not true. Thanks for watching.